will we see will we know, will there be a count of what size? Oh, I see, 15 participants right there. Okay.
Yeah, Ling Ling's having some technical issues. She said we should go ahead and get started without her, and she'll keep working on it. So.
Okay, everybody, I have two after. So we have a lot of content to get through today, so I'm going to go ahead and get us kicked off. Everybody, my name is Luke Wortley. I'm the program director of the Upper Midwest Telehealth Resource Center. We're a federally funded technical assistance center specializing as a telehealth clearinghouse for resource creation, individual education and outreach, TA across the spectrum, and convening like-minded individuals who want to promote better digital equity for all, which we're really happy to host this amazing panel today across a lot of organizations to give you the rundown of the important work that's coming down the pike. So before I hand it off to Nancy, I just want to let everybody know that this presentation today was kindly sponsored by the Illinois Association of Healthcare Attorneys, the Illinois Primary Healthcare Association, the Illinois Health and Hospital Association, and the Illinois Telehealth Network. So without further ado, I will go ahead and hand it off to Nancy to get us introduced.
Thank you. Thank you, Luke. Thanks to the Upper Midwest Telehealth Resource Center. You have just been a great, great support over the years, and we so appreciate your help. And Luke, you're just a wonderful person to work with. I'm really excited about moderating this because I was giving some thought to this, and it was really amazing to me that we are going to be talking about expanding access to the internet and digital equity. And this is a huge issue. And I first became aware of this issue 30 years ago. I was elected in 1992, the year of the woman. I was elected to the Illinois General Assembly. And in the time between the November election and the January swearing in, I spent about a month trying to think of, okay, so what legislation should I be promoting and supporting? And I came across this article in the Chicago Tribune about these people affiliated with the university that were developing a universal linked information system. Oh man, that is a great idea, because that's a way that you could expand access to information and access to care. So I went on the January 1993, I go in the General Assembly, I decide I'm going to file a bill, and I filed a bill requiring that all state agencies get on the internet. And everybody said to me, what's the internet? What's the World Wide Web? What are we talking about here? Except the people who came down and lobbied for this bill were the librarians. The librarians around the state said, yes, this is a really important way of providing information to people in communities around the state. So this is sort of a high point, because here we are, we're talking about perfecting the system so that nobody is left out. And that's what is so exciting about this grant program, both at the federal level and state level, because it's dealing with digital equity issues and ways that we can complete this process. So I am thrilled to be part of this today, and it's very exciting for us. I'm again very grateful to our supporting organizations who've been promoting this event with their membership. And I'm even also excited about this spectacular panel. Our panel, or our speakers, will begin with a presentation by the Illinois Office of Broadband on this grant system, a grant opportunity that's available to people and communities around the state to see what they could do to start equalizing and developing equity and access to the internet. And this is tremendously important. And then we're going to have two examples of people who have organizations that have been using this grant money to very effective means. One are my my team members here at the Partnership for Connected Illinois. Partnership for Connected Illinois is an Illinois nonprofit organization dedicated to expanding access to the internet and adoption of the internet. Brenda Huber is a chair of the psychology department at the Chicago School. And Terry Murphy, even though he might not be speaking much, Brenda's going to be doing most of the talking here. Terry Murphy is from the faculty at Cornell, who has been active in promoting the program that we've developed, PCI's developed, in providing behavioral health access to kids. Every day when you I shouldn't say open the newspaper. People don't open newspapers anymore, I don't think. When people look at the news, you see one story after another about the kids that are having a crisis right now. And a discussion of ways that we can provide care for them is what PCI has been focused on. And TCA Health, I really did not know about TCA Health until recently. And they provide services in the town where I grew up, near Calumet City. And they've been doing great work in Altgeld Gardens and in a variety of areas in the far south of Chicago and southeast Chicago. And they're using the internet for outreach to their clientele too. And then after those presentations, we're going to have about 15 minutes of Q&A afterwards. And Luke is the coordinator of that. So send your questions into Luke, and then he will get them and organize them for the panel to discuss afterwards. So with that, I'm going to stop talking and I'm going to turn it over. I think Ling, you're probably going to be the next person who's speaking, and then Tim Laffey at the Office of Broadband is going to be talking about the program. Ling, we're ready for you.
Hello, can you hear me?
Yes.
My apologies. Lots of tech issues today. Thank you so much, Partnership for Connected Illinois and Upper Midwest Telehealth Center, Luke and Nancy, for hosting this wonderful webinar, and for inviting the Illinois Office of Broadband for presenting with you all today. My name is Ling Liu. I am a Community Engagement Manager with the Illinois Office of Broadband. I am sort of the health contact for our team because I have 7 years experience working in healthcare, specifically here in Central Illinois with Memorial Health. In the past 7 years, working on health education, event planning, community health, and health equity work. And for the next couple of slides, I will be introducing you to our team and our department. So our team is made of 2 parts. One part is the state side under Department of Commerce and Economic Opportunity that we call Illinois Office of Broadband. And the other part is the Illinois Broadband Lab under the University of Illinois. So our team under the state side is made of 2 functions: grants management and community engagement. So I represent the community engagement side of things today, and Tim Laffey represents the grants management side of things. We are a fairly new department. We were established in 2019. And now this year, we have grown from a team of 2 to about a team of 10. We are carrying out over $1 billion in federal broadband infrastructure dollars and digital equity program funding coming to us pretty soon this year. And so we are administering at least 2 sub-grantee programs coming this fall. And this is a picture of our team retreat in Champaign a couple weeks ago. And on the lab side, so the Illinois Broadband Lab is a collaboration between DCEO and University of Illinois System. This lab contains our functions of data and mapping research and publication, as well as a digital navigator network of 10 digital navigators located under each of the 10 economic development regions in the state of Illinois. This is a wonderful collaboration that allowed the Illinois Office of Broadband to grow our capacity to support digital equity and broadband access work across the state. And next, I will be giving you all some context about this upcoming grant funding on digital equity. So I wanted to get some definitions out of the way. Digital equity might be a fairly new term for a lot of folks who are not directly involved in this field. Very much like health equity, it is a condition that means that every individual, every community, regardless of their identity, have access to the information technology capacity that is needed for us to fully participate in the society and economy of the United States. So regardless if you're wanting to use digital resources for social engagement, for community building, or for telehealth, for access to online banking, digital equity is a state that you have access to those tools and those skills to participate. And digital inclusion is the activities that are necessary to ensure that we all have access to and the use of affordable information and communication technologies such as reliable broadband, affordable broadband devices, digital skills training, technology support, and privacy and cybersecurity. Next, please. So a little background on the funding that's coming down to Illinois. Back in 2021, the Digital Equity Act was approved, and it provides $2.75 billion across the country to establish 3 grant programs that provide digital equity and inclusion. So the state planning grant was funding for states to create our digital equity plans. This one is already done. Our Illinois State Digital Equity Plan is posted on our website, and it's a wonderful piece of documentation and resource that you all should read. And the second piece is the capacity grant, which is going to be our focus for today. This is funding for each state to implement their digital equity plans. For Illinois, we're expecting around $39 million for the next 5 years to implement the plan. And the competitive grant, some of you may have heard, this is a grant administered directly by NTIA, the National Telecommunications and Information Administration. It is $1.25 billion national dollars to implement digital equity projects, and that grant is due today. So I don't know if some of you here have applied. If you have, good luck, and hopefully we can get more dollars for Illinois to advance digital equity work. Next, please. So the vision for the state digital equity plan is to making sure that there is universal access to high-speed broadband that is affordable, reliable, and scalable for individuals, businesses, and community anchor institutions. And we want to leverage new and existing resources to advance the adoption of internet use through targeted digital inclusion strategies and sustainable broadband equity outcomes, and help our underserved communities identify and address current gaps in broadband equity, and also empowering all residents of our state to use and participate fully in our digital economy and society. Actually, according to a research, 92% of all jobs today in Illinois requires digital skills. Next, please. So to highlight the 5 core activities for the state digital equity plan, one of them, which is highlighted here, is the Digital Equity Grant Program. The other 4 are community of practice. We want to form communities where practitioners of digital equity come together and share their best practices and help each other grow and advance their work. Stakeholder engagement, so this can look like coalitions and conveners in each of the counties or each of the economic development regions or larger regions of our state. Digital equity source of truth. So we will be presenting a dashboard that serves as a data source for all of the digital equity work that's going on in our state. And statewide and university partnerships. So we know that universities out there are doing a lot of wonderful work in the communities. So we want to make sure that we continue and strengthen our partnerships with universities and community colleges, etc. So why are we presenting digital equity funding for a group that's the majority of you coming from healthcare? So I wanted to make this link for you all. So the social determinants of health is something I think a lot of you are really familiar with. So I will be very brief with you here. The main takeaway of this graphic is that a lot of our health outcomes happen outside of healthcare facilities, right? Factors like socioeconomic status, physical environment, and our health behaviors, really drive our health outcomes. And how does digital access and equity feed into each of these factors? So when it comes to education, job status, family support and income, access to online remote learning, remote work, and online workforce development training, social engagement, and computer skills are really crucial for this area. When it comes to physical environment, it is very important that you have access to fast, reliable, and affordable internet infrastructure, especially for our rural areas and multi-dwelling units that have really outdated infrastructure. For health behaviors, especially throughout the pandemic and coming out of the pandemic, access to mental and behavioral health services and support groups via telehealth and virtual meeting platforms, and access to apps that help with diet and exercise have really played important roles in our health. And PCI is one of those organizations that are looking specifically into this area. And healthcare wouldn't be possible without internet access. Think about access to patient portals, telehealth, remote monitoring, teleeducation, digital health literacy, and accessibility of online health information. These are all areas that are made possible thanks to digital equity. So with this, the mutual barriers for health and digital equity are broadband access, access to devices, and digital skills. So as part of our state digital equity plan, I wanted to highlight that there are specific goals linked to health outcomes in this plan. These include expanding access to telehealth across the state from primary care to expanded treatment. All Illinois schools, libraries, and public health-related facilities will have at least 1 gigabit per second symmetrical broadband service by 2030, and higher utilization and satisfaction with remote healthcare among priority populations. And so this plan I've been talking about was the culmination of a 56-stop listening tour across the state, where we talked with different stakeholders and community members and put together. So here are some of the insights that was shared with us that highlights the importance of internet access for health. So in Southwest Illinois, a listening session participant noted that even hospital systems in their region pay 2 internet providers to ensure access when one provider's service goes out. Can you imagine that? Can you imagine a hospital losing internet connection? And a Macomb listening session participant shared that telehealth is critically important for veterans who have to use the government system. The closest location is quite far away, so it puts a huge burden on the veterans in the community to have to go to those facilities. A Bond County resident shared with the Bond County Broadband Initiative that they had a parent with diabetic equipment that depended on internet connectivity, which their unreliable internet service made very challenging. So these are real life stories highlighting how lack of digital equity impacts their health outcomes. And we also have a list of key performance indicators listed with the plan. So a lot of the goals that we're working on to achieve digital equity in Illinois. And some of the indicators are directly related to health. So we talked about increased use of and satisfaction with remote healthcare among prioritized populations, as well as improved medical record keeping and documentation. I learned very recently that a lot of the nursing homes, especially in rural communities, do not have electronic health records. Everything is still mostly on paper. I am looking forward to learning more. So if some of you have close relationships with those organizations, please let me know. And next, going to the grant program that we call IDEC, Illinois Digital Equity Capacity Grant. Here is a timeline for our grant program. The great news is that everything is good to go on our end. We are just waiting for NTIA to issue the letter for funding for us to push out the notice of funding opportunity. So we're getting really, really close now. We've done everything on our end to prepare. The rest is out of our hands. So we've been presenting on capacity building webinars since August, and we'll be providing support for applicants throughout November. We're hoping to launch the notice of funding opportunity as soon as we can, possibly early October, but definitely in October. And then we are expecting to give 45 days for the first wave of proposals to come in and 90 days for the second wave. So estimated in November and December, 2 waves of applications will be done. And then next year, the funding will be distributed to grantees and work will begin. Reminder that this funding will sunset in 5 years, but the grant will be for 3 years worth of work. So for those of you that are not familiar with NOFO, it is a notice of funding opportunity shared with the public that outlines the key information for prospective applicants that include who's eligible for applying, the timeline, and important dates and deadlines for this grant, how much of grant award will you receive, what is required as part of the application, as well as detailed process for applying. So this document will be posted once we drop the NOFO. As I mentioned, our draft is being finalized and should come out in October. So here are some of the tentative funding information that we have for now. So the funding amount will be between $30,000 to $300,000 per organization per year. And this will be a grant that has a 3-year term. There's no cost sharing or what we call matching funds required because we understand that requiring matching funding is an equity issue and access barrier for a lot of organizations. So this is not a factor here. Matching funds are encouraged, but it is not required for your application to be considered competitive. The application submission will require the uniform budget book, cover letter, application, and evidence of community support. As I mentioned just now, there will be 2 waves. Wave 1 will tentatively have 45 days, and wave 2 will have a 90-day window. We strongly recommend that you apply during wave 1 because wave 2 will only happen if we have dollars left over from wave 1. So wave 1 means more funding is available. And then finally, application review, we consider your demonstrated community need, the capacity of your organization, the quality of your proposal and budget, as well as sustainability and community support. And we've talked about priority populations a lot. So these are the covered populations that are required for us to prioritizing our work. And the reason why these identity groups are covered populations is because these are folks who are disproportionately negatively impacted by digital equity in our state. So these are low-income households, aging populations, meaning folks who are 60 years or older, incarcerated individuals, veterans, people with disabilities, rural inhabitants, racial and ethnic minorities, as well as people with language barriers. Please note that 72% of all Illinoisans are part of these covered populations. And these are the project types that we are considering in the NOFO. So they include device distribution programs, so laptop, computer, or any other devices distributed to covered populations to meet their needs to access online tools, digital literacy and skills training, so classes, workshops, coaching, or other learning opportunities to help folks build digital skills and confidence. Digital navigation and tech support, so hiring individuals who are embedded in communities, such as a digital navigator or a community health worker, who are trained to help connect folks to access affordable broadband, access digital skills training, and other essential resources. Community Technology Center, so to construct, upgrade, expand, or operate new or existing public access computing centers for covered populations through community anchor institutions. And finally, access expansion feasibility study. This one is more for local government to explore the opportunity to chart their own broadband planning path through local coordination and planning. And one thing to note with these project area is that you can apply to do work in one specific area, or your project can include multiple. But there's no restriction on how many you can include, or if you just want to focus on one. And these are the eligible applicants. So we have community anchor institutions, meaning non-for-profits, libraries, healthcare organizations, churches, county and municipal governments, local educational agencies, non-for-profits, organizations that represent covered populations, civil rights organizations, public housing authorities, any partnership that's a combination of any of these entities described above would be eligible to apply. And here are some tips for writing great proposals. So we'll be asking you to share your experience with digital equity work. And if you are just starting to do digital equity work, that is okay. Share your experience in how you have effectively served covered populations in addressing different barriers and disparities historically. Make sure to demonstrate success and outcomes with data and stories. And when it comes to demonstrating community need, make sure to list out the community resources that are available, what are some of the gaps that exist, and what are some of the outstanding needs that still need to be met in your community, again, through data and stories. When it comes to budget and use of funding, make sure to consider language access, staff training, paying staff fair wages, and emphasize how the use of funding is to aid community service. And then when it comes to implementation plan, we expect clarity and details. For example, define your activities, frequency of your activities, how many events and people do you expect to host and serve, and how are you doing outreach? How are you planning to make sure your outreach and your education, your activities are accessible and inclusive? And finally, everybody loves to hear about expected impact and outcomes, how you track the metrics, how you plan to make the efforts sustainable in the long term. And when it comes to community support, consider having, letters coming from diverse folks like politicians, local partners, community members who have experienced support from your organization, letters and newspaper articles, any way and that can demonstrate that the community has your back and really support you to do this work. And finally, think about how you tell your story in the proposal with the limited number of words that you can put in. So I hope this is helpful. Next, please. And I do want to share some health project examples. There are 3 ideas. One is to distribute devices to eligible patients and provide trainings on accessing telehealth and patient portals, and provide technology support if they need help using their computer. And a second idea is to collaborate with non-for-profits and community-based organizations to set up community technology centers with spaces for telehealth. This is one that I'm seeing a lot where, especially in rural areas, hospitals are partnering with a public library or University of Illinois Extension office to set up a remote clinic that provides privacy and stable internet access for folks. The third one is cross-train community health workers to screen patients on their internet subscription, device ownership, and digital skills level, and refer them to digital navigators and organizations who can connect them with affordable internet devices and skills training, because community health workers are already trusted individuals working on the ground, referring folks to resources. So it would just be another great layer of service to make sure that we're serving community members holistically. So my call for action for this webinar, after this webinar, is to make sure that you're familiar with the Illinois State Digital Equity Plan. This will be very helpful for you to write your proposal. Talk to your grant team at your organization, your community health team, and other teams that work to improve health in the community to start talking about this grant opportunity and how you can benefit from it. And if you have community health workers, talk to them about how they currently help patients with digital access and skills, and if they could use more support for training. And then finally, subscribe to our biweekly newsletter and fill out our intake form to stay in the loop. This is where you get all the updated information about this grant. I will drop in the link in the chat, and I'll pass it over to Tim.
All right. Thanks, Ling Ling. Hi, everybody. It's good to be with you all today. I'm going to be discussing a few things on how to get registered within the GATA portal, which, if you're not familiar with that, that is really the primary step that needs to be taken before you can apply for any state grant. So this information is going to be helpful for not only the broadband grants, but anything else that you might want to find, that you might find interesting within the state. I do want to point out at the very top here, the slide deck that I'm sharing. This morning, I got a new revised edition of the slide deck. So that's just kind of how it goes for me. But I'll try to make sure I share everything with you the best I can and keep you updated here. So kicking off here, a few things to register with the GATA system. This is the different information that you'll need to enter into GATA. And let me take a quick step back. GATA, of course, stands for the Government Accountability and Transparency Act. And see, is there a previous slide? Oh, okay. Next slide then, I guess. There. Oh, okay. I'm off already. So what I do want to mention is we want you to come to us for help going through this GATA portal. It can be lengthy, but there is services available. I'm going to drop a couple links in the chat. The first one here, this is the GATA new user guide. If you're a brand new user to the GATA portal, I recommend that you check out this user guide. It's a PDF that contains step-by-step instructions for registering in the portal, as well as answering common questions. So it is very helpful. Let me get this next one for you. Okay, this is a link to gata.illinois.gov. It's a website created by the Grant Accountability and Transparency Act unit of the governor's office. So this unit is considered the statewide experts in all things grants and GATA, and they have a large amount of information, manuals, and references on different service on several grant subjects there. So please check out those two sites. Now back into what it takes to get registered for GATA. The first one we're going to talk about is being registered with sam.gov. And we talk about this one first because it can take the longest to be completed. SAM.gov is also known as the System of Award Management. And this must be validated on an annual basis. So your entity sam.gov registration should be set to a public setting and not a private. If your sam.gov registration is set to public, then the federal site of sam.gov cannot properly sync with the state GATA portal site. So please keep that in mind when you're setting this up. A few things that you'll need. We'll stay right here for just a second. So this is the first couple of screens you'll see when you're registering with sam.gov. So you'll click create a user account, and then you'll register your new entity. One thing to keep in mind with sam.gov is you'll go in and you will create an account, but then you have to go back in and register your account. So there's really a two-part step there. When you set up your account, you're going to get your UEI number, stands for your unique identity identifier. And this number is used in sam.gov, and you'll need this number to register on the state GATA grantee portal as well. All right, we can move on to the next step. All right, so there are really 5 requirements that you need to go through to be registered in GATA. The first 3 are required before you submit an application for a grant. And we'll go through all of these here in a little more detail. All right, first step is authentication. If you're brand new, you will come here. You'll see the screen on the left. You'll create an account, and then you'll get the screen on the right, and you'll fill in your information to get yourself registered. So this is the pretty basic first step, just setting up your profile essentially. The next slide. Then you're going to get your grantee registration. So all grantees must end up being registered with the state of Illinois. New accounts must be entered in the organization's information on the registration screen. So at the bottom, you'll see some of these screens. I know we're going pretty quick through this presentation, so I really just want to have these out there so you're familiar with how it looks. Don't worry too much about keeping all this retained. As you go through the process and you use those manuals, and if you have further problems, you can reach out to us. But I just want you to be familiar with how this looks for now. We can move on to number 3, grantee prequalification. So this is what we're really looking for. When you submit your application to us, we're going to check the GATA portal and make sure you are shown as being pre-qualified. And in order to be pre-qualified, you have to be in good standing in all of these different categories that you'll see at the bottom right. So you'll see in this example, the applicant here is delinquent in the sam.gov, in the federal excluded parties list, the Illinois Secretary of State, and the Illinois DHFS sanctioned list, which doesn't mean that there's any problems. It just means we're still taking the time to sync up the GATA portal with your information with all these different entities. So that's why we really encourage you to go ahead and start the process now. You're welcome to do it once the NOFO is posted, but you can do it now and save yourself some stress of like trying to get everything in by the deadline of the NOFO. All right, and next few steps. So the last two are the risk assessments. The first one is the Fiscal and Administrative Risk Assessment, or the ICQ, also known as the Internal Controls Questionnaire. This is going to be done on an annual basis. And basically, when you go in here, it's going to take you through a series of questions asking you a wide range of financial and management questions. And there's really no right or wrong answer. We really just want to get an assessment of where your organization is at in terms of how prepared you are for handling a state grant. And if we find anything that may be deemed a risk, then what we're going to do is find ways to mitigate that risk. It oftentimes just means we set up some training with your staff so they know what they need to report on or what they need to do. So it's not any kind of a punitive situation here. We just want to find out where you're at so we can help you so that the grant funds and your project can be handled appropriately, and it's a win-win for both of us. And then the last slide here, we have a secondary risk assessment called the programmatic risk assessment. This is going to be done usually by those who have been awarded some funds. This will be an internal risk assessment done by our office here, specific to our program. And your grant manager would reach out to you with a questionnaire to fill out for that. Very similar to the ICQ in terms of we're just trying to find out where you're at and then set up any kind of measures needed to mitigate any risks that we might find. So that's the process in getting registered with GATA. Like I said, it can take some time, so I do encourage you to get started sooner than later, and then reach out to us and use those resources that are available to get this completed. And if you have any questions, let us know. All right. I think, Nancy, I can turn it back to you.
I'm great. Thank you so much. I really appreciate all the information. It was quite an education for me going through the process, and I'm sure it will be an education for other folks too, but you can do it. So I encourage everybody to delve into the opportunity that we have right now. So we're going to turn it over now to the first grantee partnership for Connected Illinois, and we're going to talk about the exciting program that we have right now, extending providing behavioral health access to kids in their schools. And presenting our program will be Brenda Huber. Brenda has been a terrific partner in this process, and she's an expert on school behavioral health, and she has lots of interesting stories to tell you. Brenda.
Thanks so much, Nancy. So we are here. I now understand why we were chosen to present today after listening to Ling Ling and Tim talk about the application process. So Luke, if you could go ahead and get the slides up and going, that would be great. So we are working to provide digital behavioral health tools to young people and their families through schools.
I'm sorry, Brenda. I'm just I'm digging through here. I don't hold on one second.
If I can share my screen, I could go ahead and share from here.
Yeah, I will give you remote.
Can you all see my screen?
Yes,
How about
we can.
okay, I'll move it over here. So, and we'll start from the top. All right, so can you see just the main screen?
That's what we see.
Okay, wonderful. So we are working with a rural partner. So in terms of covered entities, we are working in a rural location with a high poverty community. So our partner, Katie Bangs at the Egyptian Health Department, has noticed increased trauma and poverty in the rural area and increased suicide attempts and substance use, especially post-COVID. So we are working with them. Here is the location in Illinois. So this 5-county area to the south and east part of the state is a very rural area. As you can see here, there's high need in terms of poverty as well as broadband availability. Now it's not wanting to let me move my slide. All right. So what we've noticed in these rural communities is parallel disparities, both in terms of mental health and technology. So there's a lack of access and familiarity, both in terms of mental health treatment and care, as well as digital access. Then we see low competence and low confidence, as I think Ling Ling was referring to, in using care and technology, and then high stigma and distrust for technology, broadband, et cetera, as well as mental health care. At the end of the day, this is comes down to low utilization and adoption. Now, interestingly, schools are major providers of both mental health care and technology access in these rural communities. And that is our entry point. So schools tend to use a public health model, both for digital access and for children's mental health. So for example, these schools provide Chromebooks. So this triangle represents every child attending the school. If they all get a one-on-one Chromebook, that's a universal intervention. We have some students that are at greater risk because outside of school, they only have access to hotspots if they live near a library or McDonald's. Some of them get hotspots on the bus, et cetera. And all the way up to we have some kids living in communities where their schools don't even have websites, they don't have good cell phone coverage or anything. Similarly, with regard to children's mental health, the schools provide universal interventions such as social emotional learning curricula, climate work in their schools, et cetera. And then they identify children that need greater and greater intensity of services all the way up to the top of this triangle where there's acute and chronic mental health needs. So schools attempt to use this approach to provide a lot of what I call upstream care to prevent those high intensity needs. Now, Egyptian Public Health Department, which is on the right-hand side of this screen, does a lot of those heavy, intense and frequent kinds of services. But in the schools, there's a little bit of that tier 1 social emotional learning things going on. There are some one-on-one therapy things going on. But honestly, when it comes to the schools, they are at the top of the triangle dealing with a lot of crisis right now. So the sort of earlier intervention services are not as common. It is not uncommon in these rural areas for a young person's first experience with mental health care to actually be somebody calling the ambulance to come because of a suicide attempt or hospitalization just because a child wasn't able to get a first line ADHD medication. So our project is earlier intervention to increase the capacity of these school programs to provide the needed level of support in an accessible medium whenever it's needed, wherever it's experienced. We've been doing this work across the state of Illinois where we've discovered, actually, Terry, my colleague, has discovered various digital telehealth resources that are these earlier intervention tools. We've identified schools and partners where we're piloting these interventions as we are in this implementation in the southeastern part of Illinois. And our goal is to develop these step-by-step guides for schools to be able to access these tools and implement them. Now, we are not the only state doing this. California, in fact, is a little ahead of us. They have adopted 2 of the tools that we've discovered for all of their 0 to 25-year-olds so that they can get that earlier intervention. The tool that we've selected is called Parent Guidance. It provides self-guided courses on their website. They have interactive mental health webinars for parents, and they have one-on-one parent coaching where they can meet virtually with a coach every week for 30 minutes. And these earlier intervention opportunities put tools in the hands of these rural parents where stigma around technology and mental health is high and there is low adoption and utilization. So there's my information and Terry's contact information if we can answer any questions.
Thanks so much, Brenda. Do you mind stopping your screen share so I can get TCA slides pulled up here?
I sure will. Let's see. I think I will.
I got it.
There you go. Just boot me off. Thank you.
Great job, Brenda. This was really exciting to hear you talk about this. Really exciting work. I'm really thrilled to have a report now from TCA Health to talk about what they're doing on the far south side of Chicago and surrounding areas. That's really exciting. So Samantha Oliver Mitchell is their COO, and she's going to be presenting their program to us for the next 5 minutes or so. Samantha?
Good afternoon, everyone. Thank you so much for having us. It's so great to just hear all of the work that's happening across the state, and we really are excited to be able to present the work that we've been doing with the support of the TEC grant as well. Next slide, please. And you can progress the slides, keep going. This is where we are. So TCA Health was founded in 1970 as a privately owned clinic, the clinic at Alcal. That's what the TC&A stands for. And we are located bordering the Alcal-Murray Garden Homes, which is a public housing community. It's actually the second largest remaining public housing community in the US right now. And we were founded in 1972, but received FQHC status in 1991. And we one of the first of 7 public housing Section 330 grantees. So we received federal funding from HRSA to provide primary care services and related services in the Alcal community. We've expanded since then to include services in the Chatham-Hagrish community as well as in Hammond. We want to progress the slides. This is just a quick snapshot of our various locations, which includes primary health centers, school-based health centers, some community-based, some school-based. And then we also partner with Catholic Charities inside of their WIC locations to provide WIC services. In addition to our primary care services, we offer behavioral health, oral health care services, WIC enrollment, insurance enrollment, and then SNAP and TANF job readiness training programs. And those are just some of our awards that we received for creating equitable access, equity enhancers, as well as COVID champion awards, getting vaccine access to communities that needed it most. And then an advocacy badge as well. Next slide. That's the services that we covered. We see all ages from 0 onwards. For primary care, obstetrics, we have pediatricians on site. We also have dental providers, and we have a mobile health van, both oral health and primary care that goes out into various communities offering school physicals. Next slide. That's our service overview. We serve an average of 10,000 patients annually. The majority of our patients are Medicaid patients. Majority of our patients, more than 98%, are African American, some Latino, and the majority of our patients are 200% or below federal poverty level. So our patients have an annual income of $15,060 for a single family household annually. Next slide. And we offer services regardless of people's ability to pay. So during the COVID pandemic, prior to the COVID pandemic, if you can advance to the next slide. This slide is showing what we saw in telehealth encounters starting in 2020. What I would like to kind of point out on this slide is that in 2019, that was zero. We had zero telehealth encounters in 2019. And it's really as a result of COVID that we started engaging more with our patients from a telehealth perspective. Next slide. So during COVID, we saw a shift because everyone had to stay home and we had to engage in services, engage more people with telehealth services than before. And we were able to, with the support of grant funding, be able to purchase technology to create telehealth rooms for both behavioral health and primary care services, so that when people wanted to come in to receive those services, they could still have access to a physician. One of the things that we recognize is because we're in a community with poor infrastructure, many of our participants have track phones, government phones that have limited amount of minutes, and they could not actually get through a behavioral health session or a primary care session utilizing that minutes because it would take up whatever communication access they had for the rest of the month. And we also found many patients who did not want to access behavioral health services through telehealth. They wanted to come into a place because they perceived our location as a safe space to be able to come and receive services. For many of the people that we tried to do telehealth services with, they would be buffering. And you can imagine if you're telling a story of being in crisis and someone doesn't hear you, I mean, we all have technology glitches. If you're saying something important and it's buffering or someone can't hear you and you have to repeat it, it can be very traumatic or re-traumatizing. So we created telehealth spaces inside of our clinics, as well as in that picture, you can see a conference room that we've converted to a technology center where people can come in and do group interventions, employment and training classes to kind of bridge that digital divide. We've also heard lots of stories from our behavioral health clients, particularly where they want to come into a particular space and have access to the technology because the only space they have in their household might not offer any kind of confidentiality because they're sharing space with multiple people and would often have to do a therapy session in a bathroom locked in so that no one else could come in or in their vehicle. And that really is not always conducive to creating a therapeutic safe space. Next slide. So that's what we've been doing with the current funding, but our goal for the second half of the project is to really expand more into creating access through our wearables. We have a program for diabetes where diabetes and hypertension, where another grant is covering being able to provide blood pressure cuffs that are Wi-Fi enabled. And what we're finding is people don't have Wi-Fi access at home, but also they need help with pairing their cell phones with the device. And so having our community health workers work with individuals to help them get signed up, get their phones paired. We also have our front desk and community health workers supporting patients in signing up for patient portal. Can be very scary for people to figure out how to get into patient portal, how to use it, how to make sure that they can access it again, setting up passwords. We also help the community in general with just being able to set up an email address. We find that many people don't have email addresses or don't know how to check email, and there's varying levels of health literacy. So in the future, we hope to be able to increase access to webcams, video conferencing software, and then just creating and being able to use telemedicine kiosks. Next slide. So Tim, my counterpart, is the manager for our DEC program, and he was unable to speak today. His voice is gone, but he is on the call with us. That's his contact information if you want more information about our project. But we're really excited that this is expanding and being able, this grant opportunity is open for more people to have access. Thank you.
Thank you so much, Samantha. I would just like to do one little bit of housekeeping before I turn it back over to Nancy and the team. That all of the chat and stuff, links that we've been posting will also be available in a follow-up email. We also are recording this presentation for you to access at a later date.
Great, thank you, Tim. Do we have some questions here that you would direct that we start with?
I haven't seen anything come in through the Q&A function or the chat, but if folks are interested in asking questions here in real time, please use the question and answer function so that we can keep track of what has been asked and what has not. And if there are no questions, I will reiterate that the Upper Midwest Telehealth Resource Center is here for all of your TA needs for digital health broadly, but we are also more than happy to connect you with any of the speakers that were showcased here today, so that you can ask maybe a more granular question should you run into something else when you are going through the process for applying for these funds, or are interested in partnering with other organizations for this work.
Great. So should we wait another minute or two, Luke?
People are starting to sign off now, so I'm going to go ahead and stop the recording. And if we get some people who want to hang around, that's fine. Otherwise, thank you so much for attending. We are right at 60 minutes. Thanks so much to all of our presenters, and we really appreciate you coming today.
We thank you, because we really appreciate